There is a new COVID-19 mutant in town, and everyone is concerned. As a result, countries of the world have in the past 1 week been closing their airspace to flights from the United Kingdom, where the new variant emanated from. Why has Nigeria not followed suit? And how prepared is Nigeria to deal with the consequences of this supposed tardiness? Joining us now to offer us a comprehensive overview of Nigeria's handling of the COVID-19 pandemic thus far and a roadmap into the immediate future is Dr. Chikwe Ihekweazu, Director General of the Nigeria Center for Disease Control. Dr. Ihekweazu, great delight to have you again on the morning show. Good morning, and thank you for joining us.
Thank you, Ruben. Thank you, the entire Arise team this morning.
Thank you, Dr. Ihekweazu. Yes. Well, where are we with the fight against, if I may use that phrase, against COVID-19? We've heard about a new mutant strain in the UK, in South Africa, all the way to Singapore. But we're told that Nigeria cannot afford to shut down. And then there's a big issue of the vaccines. How prepared are we? Do we have the storage chain? What is the technical working group that has been put together? What is it doing? What is the update, generally?
Thank you, Ruben. A loaded question. First thing, let me just bring all of us up to date with where we are and set the scene for the other questions. Like you know, we're well into what people refer to as the second wave. The fact is that we're reporting more cases on single days than we did at the initial peak of the outbreak. Yesterday night, we had 1,133 cases. It's our second daily highest number of cases per day reported so far. So the reality is this virus is very well with us. Intensive community transmission is happening. We're seeing increases in about 22, 23 states across the country. So this is widespread. It's more intensive in Lagos, Kaduna, and the Federal Capital Territory. But really, we're seeing cases increasing across the country. So the key thing is for all of us to be aware, which is very important, that we're not beyond this. I hear people talking about during COVID as if it's something that happened in the past. Unfortunately, this virus is still very much with us, and we have to collectively keep working at it. The second thing I wanted to mention is just to emphasize on the risks. We on this show, which I watch every morning, Ruben, we talk about some of the big challenges that we face in Nigeria, whether it's the threats of insecurity in some parts, the tanker accidents that were just mentioned by Rufai. I think we at NCDC, we have a challenge. Our challenge is that it's very difficult to visualize the risk of viruses. So, when you see a tanker burning, people realize, wow, there's danger there, and I better find an alternative route or stay back at home. But with viruses, it's very difficult to explain to people that this very small thing that we can't see can cause so much destruction to our people. So we will keep working at this to convince the fellow Nigerians that we're faced with an existential threat and that we have to keep working together. Now, Ruben, to your question on the new variant that has been described in the UK and another similar one in South Africa, I want to first say that viruses change all the time. So that viruses are mutating is really not a surprise. It's what they do by their nature. There are some that change faster and some that change slower than mutate slower than others. Now, this is a new virus, so we're still learning a lot about it. The critical question is, are those changes, do those changes lead to a difference in either transmissibility, severity, mortality? So does it have an impact on the outcome? Early data suggests that the new variant in the UK does have an impact on transmission. And so intensive studies are going on now to understand how much this is playing a role. But there are other countries with intensive transmission. in the US, for instance, that we don't know whether it's linked to this new variant or not. They are also beginning to look at their own data and to study this. Same as in South Africa. In Nigeria, we've done, to understand if you have a new variant or not, you have to do something called sequencing. So breaking down your virus and studying each DNA of it in detail to understand where the mutations are and the impact it has had. So we did some earlier in the outbreak. It's a very complex process. There are only 3 public locations, laboratories where it can be done in the country. We did some earlier in the outbreak. We're now doing a bit more of that to see whether we can find that strain in the country. But having said that, a mutant strain alone is not enough to explain what is going on in Nigeria. A more likely explanation is that we simply dropped the ball. We thought this outbreak was over. We tried to return to life as normal, which I completely understand given the difficult year we had. But we are now paying the price for not doing what very difficult measures, but something we needed to do as a society to prevent an escalation. We're now paying the price for that. It is not too late. It is never too late to compose ourselves again. And that's what the state governments are really leading on right now, to reinvigorate our own activities, our leadership, enforcement, compliance, and give up some of those things we hold very dear at this time of the year in order to have a year to look forward to in 2021.
Indeed. Well, Doctor, scientists in Osun State, Ede, say they detected the variant in the UK in Nigeria as far back as August. What more do we know about that? I like the fact that you said we are doing the genetic sequencing, and that's what the UK has done a lot of to be able to identify this. So what more do we know about that variant being in Nigeria as far back as August? And as for the second wave, what's the difference this time around? Are we better prepared to handle a second wave? What is it going to look like for Nigeria?
Thanks, that's right. You know, the report out of Ede is from a team led by Professor Christian Happy. He's one of our strongest collaborators at the Africa Center for Excellence in Genomics in the Redeemers University. And it's a key collaborator of the Nigeria Center for Disease Control. You remember when we reported the first sequence out of Africa, it was in collaboration with themselves and the Nigerian Institute for Medical Research in Yaba in Lagos. So we're always working together. We have since clarified that the strains found in Nigeria in August and October are similar, but not the same as that in the found in the UK, so that they were actually independently evolved strains, the same as in South Africa. They are similar and not the same. So we're now looking into in more detail. It was found in 2 patients, and remember, 2 people, the strain in 2 people is not sufficient to reach any conclusions. What we need to know when there's a new strain is how much that new strain has been able to displace the other strains in circulation and therefore dominate the strains of the viruses circulating and therefore causing a disease that is slightly different, either more severe or less severe than the others. And so that's what we have to do now. We don't have the capacity in the UK to do the level of sequencing done. UK has one of the highest capacities for sequencing in the world, and not just in comparison to countries in Africa, but in comparison to other countries in Europe, because you have to do that sequencing longitudinally over time and to scale. So what we're doing now is collecting a random collection of samples that we already have and working with our colleagues at Redeemers University to identify whether this strain is circulating or not, and what impact it has had. On your second question on the second wave of the epidemic and if it's more severe and if we're better prepared, you know, there are things we know about this virus, the things we don't know, and the things we don't know that we don't know. Now, what we know are the modes of transmission, and that's what has led to the measures that we've advised. And this is very similar to measures advised across the world. We also see similar challenges in Nigeria as across the world. The difficulty in managing human behavior, and in societies where this is more efficiently done through instruments of the state, such as in Eastern Asian countries, in China, in Vietnam, where there's a very strong state to implement measures and force people literally into patterns of behavior. They've been much more successful in managing behaviors in their populations. In countries where there are liberal democracies, where people's rights are very important, where I might argue Nigeria is tending towards it, it's more difficult for the state, using the instruments of the state, to manage human behavior. In recognizing that, very early in the outbreak, we really pushed on individual responsibility and collective responsibility of leaders of people. And we've now come to the unfortunate and difficult conclusion that it's just not enough, that we as individuals are not able ourselves in sufficient numbers to manage our own behavior, that draw to go to a party, event, a wedding, a celebration is so intense in our culture that it's almost impossible for us to manage these urges. So in collaboration with the executive governors of many of the states in Nigeria, we've come to the conclusion that some level of compliance and enforcement is necessary. And thanks to their action, which you're now seeing in many states, we're beginning to having to limit the opportunities of people coming together. But it will never be possible to do this through only the instruments of the state. So we have to continue appealing to people and community leaders, family leaders, religious leaders, to do what they can do. And that's why we, at the Nigeria Center for Disease Control, have launched a campaign this week called Celebrate Responsibly. And so if you have to come together, please do so outside. Please manage and limit the numbers of people that absolutely have to come for that funeral. Keep washing your hands. And if you're the only person wearing a mask in that room, please keep that mask on, because it's making an important statement. Don't feel the peer pressure because everyone is not wearing, I'll take off mine. Really, rather push them to wear theirs. And that's the leadership that we now need, especially during this period of the end of the year. So just to conclude, it's been a tough year for all of us, but we can't afford to give up now. And that's our collective appeal to all Nigerians, to please work with us and work with the state governments to manage to hold this down. I am really worried about the capacity of our healthcare delivery system to manage the number of cases we're beginning to see turning up in the hospitals every single day.
Dr. Ihekweazu, let me wish you Merry Christmas. It's Christmas Eve today. Let's not forget the celebration amidst all of this. But there are questions on the minds of a lot of people. Number one will be, where are the vaccines? What vaccine are we even buying? We're hearing things like Kenya is doing like a 10 billion shillings deal. They want to get some vaccines in. You can see Mexico bringing vaccines in, welcoming the vaccines at the airport. Where are vaccines? Which vaccines are we taking? Are we taking the Russian one or Sinovac from China? Which one are we taking? I hear 400 billion in the works. What is that going to do? We want to know answers to those questions. And secondly, I always ask you this. Results of that zero prevalence test. We need it like yesterday. We need those results. We want to know how prevalent it is in society, COVID-19, I mean.
So thanks a lot. Let me take your second question first, because it's more straightforward. We have started the analysis of that study. We've tested all the samples. So within the first couple of weeks in January, we will announce the early results. So it will provide us a lot more insights in terms of the intensity of transmission in Nigeria. So just give us a few more weeks to tidy up the data, and so we can have confidence in the outputs. Your first question around vaccines, the efforts are being led by a sister agency, the National Primary Healthcare Development Agency, under the leadership of the Honorable Minister of Health, and of course the Presidential Task Force, giving us a broad leadership on this. What I'll have to say is, to be honest, nothing is keeping us busier right now. Our colleagues are working extremely hard on this. There are certain guarantees of pathways of delivery of the vaccines, of the first set of vaccines, somewhere around the first, within the first quarter of next year. We've been guaranteed vaccines to cover 20% of the Nigerian population. That's about 40 million people. And that's a lot of vaccines to start with. It won't cover the entire country. But remember, you still have to distribute and use and vaccinate 40 million people. So even if we had those vaccines now, there's a huge logistical effort that has to happen. And that's what planning is happening for. Our working assumption is we are not going to be able to use the Pfizer or Moderna vaccines to scale. I haven't said that we will not procure any, and our leaders are making those difficult decisions. But within the circumstances of Nigeria, the working assumption is not to use them to scale. There are other vaccines in the pipeline that our leaders will make those decisions within the next few weeks to define which vaccines we will be using, and we're able to distribute effectively in Nigeria. But a lot of work has gone into this, and they continue to work, planning, distribution points, location, freezing, and all of that. So we've got to trust the colleagues working on this, and I'm sure they'll provide the country with a detailed plan, as we've already been providing our political leaders. But there's a lot of other work to be done. To explain to Nigerians articulately the utility of the vaccines and the benefits it will bring, to assure them, as much as we understand, of the safety of the vaccines, to allay any fears. And this is very hard work. So every day I receive a new WhatsApp message with a doomsday narrative about the vaccine. I hope that people will really give us a chance. No medical intervention, Rufai, since the onset of humanity, has saved more lives than vaccines. Not antibiotics, not surgery, not ambulance services. Nothing has saved more lives than vaccines. So we need to explain this to Nigerians, that this shot given is really a miracle. This shot that we give to our children in primary health care centers across the country, and we no longer place sufficient value on it. 40, 50 years ago, each family will tell you about how many children each Nigerian family lost in childhood because of diseases that are now history. So we need to really put a focus on the opportunity that vaccines offer to mankind, and really look forward to focusing on the benefits we can derive from this virus once we receive it. Our work on this side of the aisle is to make sure that we have access to these, we are able to distribute it efficiently, and I have confidence in the leadership of the National Primary Healthcare Development Agency. They've been doing this for years, mostly for children. This is a slightly different population because we're vaccinating everybody at different levels of priority, but it's a new challenge, and I'm confident that they'll be able to lead the country through this.
Well, Dr. Ihekweazu, are we not moving rather slowly, too slowly, with regard to putting the necessary details in place with regard to this vaccine, in terms of distribution, in terms of setting up cold storage chains, in terms of, even the personnel for inoculation purposes when we get to that stage? And then what are we doing with regard to advocacy, public enlightenment? Because I think it was even the health minister himself who expressed concern about the fact that many Nigerians may be skeptical about the vaccine. And it's not just Nigerians alone. Vaccine hesitancy is what we've seen in other parts of the world, in the US, in Italy, and other parts of the world. So what are we doing really to prepare the people themselves so that we don't have the same kind of politicization that we had with the polio vaccine? But let's take a quick commercial break, Dr. Ihekweazu. When we return, the conversation will continue. Please stay with us. Welcome back to the morning show here on the Arise News Channel. Still with us is Dr. Chikwe Ihekweazu, Director General of the Nigeria Center for Disease Control. Dr. Ihekweazu, thank you for staying with us. So I was asking you about our level of preparedness, our pace, and what we're doing to enlighten and prepare the people.
So thank you, Ruben. For your first question, it's a bit like when you're building a house. The most difficult and important parts, the pillars, the foundation, the decking, people hardly see that from the outside. And it's only when that house emerges and you start painting and people start saying, listen, wow, what a beautiful house you've built. But all the hard work had happened quietly without the visibility. And that's really what is going on now. There's a lot of hard brick and mortar work going on. Thankfully, we're not starting from scratch. Many countries haven't done vaccination campaigns for years, for decades. But we have had the unfortunate opportunity. I say unfortunate because we were the last country in Africa to eliminate polio, even if we have now. It means that we still have people that know how to manage campaigns. They've done this for years because of the intensity of activities that were necessary for immunizing people to scale within short periods of time. The difference is the population. Previously, this was done for polio, mostly for children, for yellow fever, also a slightly older age group. But this time we're doing it for all ages. So there's a difference in the target population. But in terms of the planning, what we call the micro planning, the distribution, the warehouses, the zonal interface, the movement from the national stockpile to the zonal to the states, there are people that have done this for many years, and we have a well-oiled mechanism to implement this. So they're working very hard right now. Even if it's not visible to many Nigerians, the house is being built every day as we speak, led by our colleagues at the National Primary Healthcare Development Agency, with whom we work very closely together. On your second point, Ruben, that is really where we will have to really start 2021 with a bang. We really have to raise our voices across government, across civil society, the media, our leaders, to really demonstrate and explain the value and opportunity that vaccines will bring for us. I think about the limitations of our way of life this year, even to Christmas this year, and to the end of year celebrations, and what we would have been looking forward to doing. I think this year I would have been preparing for the dance, the village dance that we have in my village in Imo State every year, where everyone gathers for this festival, full of people, full of life. And I'm going to pass on it this year. I'm trying to convince them actually not to hold it at all this year. And these are huge sacrifices that we have made as a people into a way of life. And the vaccine will provide us an opportunity, again, to engage, again, to celebrate, to eat together, play together, pray together, sing together, worship together. And really that's what the message we need to get out to Nigerians next year, that this is what the vaccine will provide, so that we get away from the imagery of a needle going into people's arms to an imagery of life, the celebration that symbolizes our way of life in Nigeria. And we want to get back to that point. And this is the opportunity this vaccine will provide us. And that's what I look forward to. So this year has been the year of COVID, a terrible, challenging year for Nigeria and many countries. We want next year to be the year of the vaccine that sees us emerge from this difficult year and to face the future with confidence.
Well, thank you very much, Dr. Ihekweazu, for the updates and for all the clarifications and the information that you have offered this morning. Thank you very much indeed.